And now let's move on to the issue of field hospitals. People are quite worried that if there are enough beds for patients that as we can see that the number of infections are increasing every day. And recently, the Bangkok Governor Aswin Kwanmueang has inspected the Bang Khun Thian Geriatric Hospital, which has been used as a field hospital to monitor asymptomatic COVID-19 patients and also observe the vaccination process at the hospital as well. Aswin said that almost 500 people were waiting to be inoculated on the first day, which is today after the Songkran holidays, and that leads to a shortage of medical staff as well as necessary equipment. So therefore, they have already coordinated with other hospitals to provide additional staff and equipment. He also said that he has ordered the director of the hospital to add 500 more beds as well as to expand the area on the second floor of the hospital to prepare for more patients, as 400 beds have already been occupied. And for the initial part, 400 beds out of 500. That is a lot here. And recently, the Bangkok Metropolitan Administration has also coordinated with 11 hospitals under its administration to prepare for more patients as well.
And also earlier today, the commander-in-chief of the Thai army, he also come out and said that the army totally supportive of building the field hospital, and they have already prepared numbers of field hospitals around the country to make sure that we have enough beds for the people that get infected with COVID-19. There's a little bit different policy in Thailand from many other countries. In other countries, in a lot of countries, people that get infected, if they're symptomatic or they have mild symptoms, they will be asked to just isolate themselves at home and take care of themselves, so to speak. But in Thailand, anyone that tested positive for COVID-19, having symptoms or not, they will ask to stay, not ask, they have to stay at the hospital. So if the normal hospital beds are filled, they have to go stay at the field hospital instead.
So basically, what I've also heard is that if you've been tested positive for COVID-19, but you choose to stay at home, you might be prosecuted as well.
I'm not sure about that. I think the government hasn't been, if there is a law there, the government has not been clear enough to explain that. But
Right.
what we know is if any hospital give you a test and they found you positive, they have no other choice but to admit you to the hospital. So last week, that's why we have a news of a lot of hospitals have to close their test service because they don't have enough people, or they don't have enough beds to facilitate the infected already. So they have to just stop and prepare themselves again.